Good evening, guys. Hi, thank you so much for joining. Please stay tuned. Hi, everyone. Thank you for joining. हेलो रोहन. हाय सोनू. आपके अगर कोई भी क्वेश्चंस हो पिगमेंटेशंस के अराउंड, स्किन पे जो दाग धब्बे होते हैं, कोई भी प्रॉब्लम्स होती हैं, अगर आपके कोई क्वेश्चंस हैं तो प्लीज़ आप शेयर करिए. हमारी एक्सपर्ट ज्वाइन करने वाली हैं और वो हमारे से पिगमेंटेशन से रिलेटेड क्वेश्चंस पूछेंगी. Hi guys, thank you so much for joining. Please stay tuned. I'm going to be inviting our expert for the day and she will be talking about hyperpigmentation. I am sure आप सभी के बहुत सारे questions होंगे कि चेहरे पे दाग क्यों हैं और कई बार हमारे चेहरे पे निशान आ जाते हैं, कलर खराब हो जाता है. तो ये बहुत सारी इश्यूज हैं जो हम आम डेज में फील करते हैं और कईयों के साथ होता है ये सब. सो हमारे पास जवाब नहीं होता है अक्सर. कई बार हम डॉक्टर के पास जाते हैं, कई बार नहीं जाते हैं. बट आज आपके क्वेश्चंस के सारे जवाब आपको यहाँ पे मिलेंगे. स्टे ट्यून. थैंक यू लक्ष्मण आपका क्वेश्चन पूछने के लिए डार्क सर्कल्स का. मैं डेफिनेटली इस क्वेश्चन को पूछूंगी डॉक्टर से. हाय माया, थैंक यू फॉर योर क्वेश्चंस माया. आई होप आप एक स्किन का भी क्वेश्चन पूछें हमसे. आपके क्वेश्चन को डेफिनेटली हम आंसर करेंगे बट वो हेयर के अराउंड है और आज का सेशन हमारा स्किन केयर का है. हाय सोनम, आई एम इनवाइटिंग द डॉक्टर. प्लीज स्टे ट्यून. Hi everyone. Thank you for asking the question, Silky. Uneven skin tone and pigmentation. Soon the doctor would be along with us and she'll be answering all your questions. Stay tuned, Silky. I hope आप लोग की वीकेंड की प्लानिंग स्टार्ट हो गई होगी. वी आर ऑलरेडी टुवर्ड्स द वीकेंड बट डेफिनेटली अपनी स्किन केयर मत भूलिएगा. यू ऑल कैन टेक लॉट ऑफ टिप्स फ्रॉम टुडेज सेशन. Stay tuned. Dr. Nishita Ranka, she's a Hyderabad-based dermatologist. She'll be soon joining us. Sorry to keep you all waiting, guys. Just 2 minutes. I'm sure there is some technical issue because of which she's not able to join the session. I'm asking her to join it again. तब तक आप अपनी सारी स्किन केयर से रिलेटेड सवाल हो उनको प्लीज इकट्ठा करके रखिए. आपको जो भी कुछ पूछना होगा आपकी फेस से स्किन से रिलेटेड, समर्स आ रही हैं, क्या करना चाहिए, कैसे अपनी स्किन को हेल्दी रखना चाहिए, और अगर आपके फेस पे कोई निशान है, कलरेशन की प्रॉब्लम है, पिगमेंटेशन है, तो आप सभी सवालों को तैयार रखिएगा. हेलो एवरीवन. बबलू, टिल द टाइम हमारी डॉक्टर ज्वाइन कर रही है मैं बताना चाहूंगी आप थ्राइव का हेयर सीरम यूज कर सकते हैं. अप्रोक्सीमेटली 5 से 6 महीने आपको रिजल्ट्स तब तक डेफिनेटली दिख जाएंगे.
हेलो. Hi, am I
Hi,
audible?
Dr. Nishita. Hi, thank you so much for joining, Dr. Nishita. I would like to begin with a very quick introduction about our expert. Thank you for joining, Dr. Nishita Ranka. She is an internationally acclaimed dermatologist and is an expert at diagnosing and treating various skin conditions. She's a medical director and founder of Dr. Nishita's Skin, Hair and Aesthetic Clinic, which is Hyderabad's most advanced and trusted clinic. Thank you so much, ma'am, again for joining today. And we are glad to have you share all your experience and recommendations for people suffering from hyperpigmentation. So, ma'am, I was just telling our audience about this whole session is going to be about hyperpigmentation. So, we would want you to begin with what exactly is hyperpigmentation? Who are the people who suffer from this? And what are the possible reasons for all these things? Yeah, ma'am, please begin.
Sure. Thank you, Rakhi, for the introduction, and thanks for having me. I thank ThriveCo for the opportunity. It's great to be here on the live today.
Pleasure.
So when you speak about hyperpigmentation, it's a very vague term. It's like saying food, you know. So
Yeah.
now food we know has different cuisines, has, different tastes. So if you say just hyperpigmentation or pigmentation to a doctor, unless you give it a diagnosis, it can be 1,000 things. So it's important to know what kind of hyperpigmentation you have. By the basic definition of hyperpigmentation, what it means is hyper meaning more,
Yeah.
and pigmentation is more pigmentation. So there is hypopigmentation, which is less pigmentation, and hyper, which is more. So at any part, any place in the body where you feel like it's slightly more pigmented than the rest of the skin or than your regular normal skin color, that in
Mhm.
general is a very broad term called as hyperpigmentation. Now,
Yeah. Yeah.
it can happen because of a variety of reasons. Again, there is a huge list of causes of hyperpigmentation depending on the area of the skin or the body that it involves. But I think for clarity of this live, let's keep it primarily for the face. Is that
Yeah.
what you had in mind?
Absolutely.
Because
Absolutely.
even hyperpigmentation of the face can be divided into a lot of things. So if we go by classification,
Yeah.
now if you want to know about the causes, we cannot speak about causes of hyperpigmentation without talking about sun exposure, which is
Okay.
photopigmentation in our language, or tanning in just regular terms. So anybody who's spending a lot of times outdoors or is exposed to the sun a lot, its skin's normal defense mechanism, the melanin pigmentation, the melanin synthesis in that particular area will increase, and that skin will look pigmented. And as much as we might not like it, but this is actually protecting our skin from a lot of damage. When a tan
Mm-hmm.
happens, it's our skin's natural defense mechanism. The melanin cells there increase to protect our skin from the damage that happens underneath. And in that sense, I think we are blessed to be born with brown skin. I tell this to everybody because if you notice that we do not have as many skin cancer cases in our population, that's because we are born with brown skin. But if you go towards the West and the Caucasian skin that's there, they're more prone to skin cancers anywhere on the face or the body very, very commonly. And that's because they do not have as much melanin into their skin. So
Mm-hmm.
pigmentation or melanin is not all bad. Yes, of course, when it is at particular areas or if it is localized, it doesn't look very nice and you want to treat that. Okay. But
Yeah.
before we get into more details and take up more questions, would want to tell everyone here that we should be proud of our skin color, and in fact brown skin is protecting you from a lot of skin cancer, so you should not try to change your skin color. When we speak about hyperpigmentation and when we'll talk about treatments, it will be primarily to bring back your original skin color, but it cannot make, just treating this will not make you shades lighter or make you like somebody else's color. So I think we should flaunt what we are born with and be proud of our color. And when we talk about now causes of hyperpigmentation, let's begin from the maybe, divide the face into parts and begin.
Yeah.
In clinical practice, what we very routinely see pigmentation on the forehead. A lot of men especially have darker skin here, and the rest of the skin is much lighter. And this most commonly can be because of a condition called as frictional hyperpigmentation. A lot of these men are either working outdoors or they're men who sweat a lot. So they have this common habit, of women in that case, they keep wiping, they keep rubbing the forehead. Or sometimes they keep rubbing with a cloth when they're going to the gym, something that's rough with their bands and things. That can cause frictional hyperpigmentation, which is more on the forehead. Another common cause of pigmentation here could be your hair colors. Now, a lot of
Mm-hmm.
chemical hair colors, ammonia is not the only culprit. There's another ingredient called PPD, which you should look for. And if you're using a hair color which has this ingredient called paraphenylamine diamine, then each time you wash your hair, a little bit of pigment is coming and getting settled in to the
Yeah.
skin. So that also adds to your pigmentation. Another common cause of this frictional hyperpigmentation that we see on the forehead is people who use a lot of these headache balms. So they must be using Jandu balm or all of these balms very regularly, here. So very typically, this part is what becomes darker than the rest of the skin. And
Yeah.
of course, photopigmentation, people who are spending more times outdoors also usually typically have pigmentation here. Okay. So
Mm-hmm.
that's to do with the mostly the broad classification of causes of hyperpigmentation if you have it only on the forehead. Now, moving
Yeah.
down, there is also hyperpigmentation which can happen around the eyes. So not all
Yeah.
under eye circles are because of hyperpigmentation, but some form of under eye circles are because of that, especially in patients who have allergies or dry eyes. They keep rubbing the eyes very frequently. So that
Mm-hmm.
itself, causes the skin here to become thicker and that will become darker. And these are the
Yeah.
cases of under eye which will actually improve with under eye creams. Because if it's because of other reasons like hollowing or, because of the sunkenness or the shadowing that's happening, then under eye cream is not going to help you because there's no pigmentation there to treat. But if you
Mm-hmm.
really have pigmentation, you can probably get this evaluated with a dermatologist. And if it is actually pigmentation, then it will improve by using skin lightening creams under the eye, like eye creams. Okay.
Okay.
And then
Okay.
moving on to the mid face, when we speak about this, the most common type of hyperpigmentation here is something called as melasma, which is primarily seen on the butterfly area of the face here. You must have, all of us would have seen women, especially with, brown spots only here
Yes.
or brown spots distributed here.
Yeah.
Okay. This is
Yeah.
called
Yeah.
as melasma. In Hindi, it's called as chai. Telugu,
Mm-hmm.
which is the language here, it's called as Mangu in the local language here. But very, very commonly, this is also happening it can happen in pregnancy because of the hormonal changes. It can happen in men as well. Or nowadays, we're seeing a lot of post-menopausal women, women in their 50s or late 40s are developing this pigmentation here. Now, this is related to hormones. So like we are going part by part, you're understanding the different pigmentation because of different reasons. So we should know the reason, only then we'll be able to treat the pigment. So for
Absolutely.
melasma, the hormones have to be brought back into control. It is also aggravated by sun exposure. And that's a very resistant kind of pigmentation, very difficult to treat completely. We see it a lot
Yeah.
in women who are not spending time outdoor, but these are women who are also a lot in front of the stove. So it's the kitchen heat
Yeah.
that's adding to the pigment here. And they're like, no, we are
Mm.
not going outside, but you have to use a sun protection or a sunscreen even indoors. Even if you're spending a lot of time, in front of blue lights or screens or laptops, that can also aggravate this. Okay. And
Absolutely.
so that's melasma. And when we move to the side of the face, sometimes we see some patients with more pigment here on the sides. That can also be frictional. Another cause for that could be obesity. So there is this pigmentation called as acanthosis nigricans, which happens because of weight gain. So as we gain weight, there are certain hormones in the body which increase the pigment at certain areas, and that skin becomes very rough and thick, which is called as
Yeah.
acanthosis. This can also happen on the neck, on your underarms, thighs, etc. That we see here as well.
Yeah.
So in
Yeah.
such
Yeah.
patients, when we see pigment here, we have to rule that out and treat that. Okay.
Okay. Yeah. In fact, somebody has asked also, ma'am, face ki one side mein dark ho gaya hai. So, what would you suggest to that person? I think he's a male. So, yeah.
So are you driving a vehicle where you're sitting on that side if the window is on that side? This we see very commonly. So if you're driving a car or if you're driving a two-wheeler and your sun is hitting, you're going on the same route every day and this is where your sun is hitting you, then probably this side, that is why is more pigmented. Or if at work you're sitting by a window where the window is only on one side, that can be a cause for a unilateral pigmentation. So you try and think what you're doing daily in the day and where only one part of your face is getting exposed. So then you'll have to probably get, more protection here or change that in certain way. That will help you, yes.
That's so interesting. I mean, we don't pay attention to such smaller facts that you just mentioned, gas ke aage kaam karna, or it could be the window, or it could be the car. So definitely, I mean, that's a key takeaway also for us.
Mm-hmm. Yeah, so it's the little things. See, as doctors, when we are looking at a patient, a lot of things go on in our mind. We try to think, okay, why is it happening in this particular patient? Because unless we try and tell them how to change their lifestyle, they're not going to get the benefit out of our treatment. They're not going to be satisfied. So it has to
Yeah.
start from there, from the cause, and then you do protection, and then you use skin lightening cream. So if everything is in place, only then you'll be able to see a difference actually in your skin.
Absolutely, absolutely. So, ma'am, what are usually the treatments when, like, when patients come to you, what are the first line of treatment maybe? For example, if somebody has got pigmentation under the eyes or on the face, or at times, as you just rightly said, due to pregnancy also, people do suffer from pigmentation and the color usually changes around the neck, on the face. So, what is that first line of treatment?
I will get into that quickly, but I think while we
Sure.
are going into this, we've not covered the nose and the mouth.
Absolutely.
I'm going to
Sure,
quickly
sure.
cover that.
Please, please.
So nose, when
Yeah.
we see pigmentation, very commonly we see a transverse nasal crease here. You'll notice a lot of people have one line here. That can happen because of allergies and people who get cold cough frequently, people suffering from sinus issues and all of that. They keep rubbing their nose, and that forms a line here. So again, that's the cause. You think about the cause and we'll talk about treatments later in the live. Coming
Yeah.
down to the face, when we see pigmentation, now very commonly nowadays we're seeing pigmentation around the mouth, which is called as perioral pigmentation. This can
Mhm.
also be related to hormones. It can be related to toothpaste. It can be related to face, lip cosmetics that you're using, your lipsticks, and people who are constantly rubbing this area also could notice it.
Mm.
This is perioral pigmentation. And then some patients who have pigmentation on the neck, like we discussed already, is probably because of weight gain. So once you know which part of the face you have pigmentation and what are the probable causes and you treat that, we move on to the first line of treatment, like the question that was asked for you now. So
Mm.
irrespective of the type of pigmentation that you have, you have to start if there's the one product that you have to use is a sunscreen. It goes without
Okay.
saying, because you know that some form of exposure is there. Either it is sun exposure, or it is exposure to blue light, or it is from your kitchen infrared. All of these lights, you need a sunscreen. You need a good SPF, about 30 if you're indoors, or at least 50 if you're spending time outdoors. You need a sunscreen that's suited to your skin type. See, a lot of times I notice that there are patients who are, not using their sunscreen to their skin type. So they are using either a opposite type of sunscreen, so they don't like the feel of it. Either it dries out their skin too much or it makes them feel too oily. So find a sunscreen that's right for your face type. And thirdly, use enough quantity. So you must be
Yeah.
applying sunscreen. You're just using a little bit of sunscreen, not going to protect you. So for the
Yeah.
face, we say at least one finger unit is this much
Yeah.
for the entire
Yeah.
face, and then one finger unit for the neck unit. And
Yeah.
reapplication, even the best of sunscreens do not protect you beyond 3.5 hours. So
Okay.
reapplication, especially if you're somebody who's trying to tackle hyperpigmentation, is important. So the first line
Okay.
for me would be SPF for sure.
Okay. Okay. Any particular ingredient, ma'am, that you would like to suggest to people? Like, of late we have come across there are a lot of these active ingredients that are being introduced into the skincare, and people are actively taking care of those, using those ingredients in their skincare. So, any active ingredient that you would like to suggest to our users?
Definitely. So there's a whole lot of skin lightening agents which are in the market, also available over the counter, which are
Mm-hmm.
a little mild. So we'll probably be talking about that first, because there is prescription strength for which you need, a
Yes.
prescription from a dermatologist, because you will need to use a moisturizer with it. It can cause dryness. Sometimes it can cause more, photosensitivity,
Yeah.
etc. But safe
Yeah.
agents, I would say you could look for vitamin C. Vitamin C is an
Okay.
excellent antioxidant, so it has additional protection from sun, from blue light, etc. Also, you can look for
Okay.
kojic acid, you can look for arbutin, you can look for licorice. All of these are ingredients that you can look for in your skincare itself. So you could look for a sunscreen which has some of this. You could look for a moisturizer which has this. Niacinamide is again a very good ingredient, which is very commonly available over the counter. And now
Mm-hmm.
there are other ingredients which are, stronger, which we know will work deeper, but you need a prescription for that. Probably like ingredients like azelaic acid, like retinoids, retinols, which are there, ingredients like hydroquinone. All of these work well for pigmentation, but if it's not used correctly, and if you're not, if you're using prescription strength but not consulting a doctor, you could end up in more pigmentation because of using
Absolutely.
these. So there are some
Yeah.
which are listed earlier, which are safe over the counter, which you can just pick up and start using. And if it still doesn't get better, then probably consult a dermatologist.
Absolutely, totally understand. In fact, there are so many myths also, ma'am, around hyperpigmentation. People feel that ये कर लो बस सब ठीक हो जाएगा, ये remedy use कर लो and सब ठीक हो जाएगा. So today we would also want to bust some of those, myths that people have got. I'll be reading out some of these myths, and I would like to have your expert opinion on them too.
Definitely.
So yeah. So one is using a stubborn scrub can remove any stubborn pigmentation.
Yeah, this is, I think, one of the most commonly believed pigmentation myth. And a lot of educated people do this also, because I think it's normal human tendency or just plain logic. You feel like, okay, it's probably because you're not cleaning it well enough, or you're not, some people also say this, I'm probably not cleaning it enough and that's why I'm scrubbing.
Yeah.
But what they
Yeah.
fail to understand that this is causing the opposite effect. We just
Yeah.
discussed about frictional hyperpigmentation. So any part of your skin, if you keep rubbing it, if you're keeping on scrubbing it, it's going to get darker. So
Yeah.
this
Yeah.
this is going to give you the opposite effect. So I strictly do not recommend using any sort of loofahs, any sort of homemade scrubs, any sort of scrubs from these apricot scrubs, and a lot of these scrubs which are famous in the market, that can increase your pigmentation and make it worse. So
Yeah.
you don't need any sort of additional cleaning. God has made thick, this skin here is much thicker than the skin on the rest of our body, because that's enough to clean. Our hands
Yeah.
are more than
Yeah.
enough. You don't
Yeah.
need additionally any sort of, pumic stones. There's a lot of things that people use.
Yeah.
So refrain from
Yeah.
using anything that is hard or rough on your skin that's going to increase your pigmentation. It's not going to make it better.
Okay, great. The other one is, if I avoid sun, I will be pigmentation free.
Not necessarily, because you can sit in your own house and get tan. So this theory got proved, in fact, while COVID. So immediately after the lockdown opened up, and we saw patients who were just sitting at home for 1 year fully, not going out
Yeah.
anywhere, but they're still darker. There is pigmentation on their face or certain parts of the body. That's because even sitting in your own house, you can get exposed. Your devices, your lights, your stove, your phones, we are not away. In fact, after COVID, I think all of us are more addicted to devices, and we are doing so many things online. Even doctors, we've started working online and stuff. So inside your own house also, that's why the whole concept that you don't need a sunscreen if you're going out is very obsolete now. You don't need a sunscreen indoors also, even if you're just in a room with lights and screens.
Absolutely. Absolutely. Yeah, because I remember you just telling that even while cooking, we can get hyperpigmentation because of the heat.
Correct.
So yes, definitely. So guys, we can, even if we avoid sun, we are going to get it. So the next question, the next bit is, once it's gone, it won't come back.
Again, this is a big myth. All dermatologists wish that this was true, because
Yeah.
we do so much, we do treatments in the clinic, and we're doing peels and lasers and so many things, and the pigmentation's gone.
Yeah.
Now the patient stops using sunscreen, stops the active ingredients at night because they're bored, or they, get pregnant, there's hormonal changes, or they hit menopause, there's hormonal changes, they go on one holiday where they've not used sunscreen and it's come back. So pigmentation is something that's waiting to come back, I would say.
Yeah.
So,
Yeah.
just clearing it is only half the battle won. The rest half is keeping it in control, which is very difficult.
Absolutely. And I guess these ingredients plus these, the sunscreen are some of the things that people should use to keep it at bay forever.
Yes. So there's something, known as maintenance therapy. So once you're over the active therapy where you're using so many products, you can maybe ask your doctor for a little shorter prescription saying, now how do I maintain it? You have to continue to use at least some maintenance products, because, you're prone to it. So it can happen. It will rebound back if you're careless.
Yeah. Absolutely. The next one is, consuming certain foods leads to pigmentation. For example, even my dadi and nani used to say, "Zyada chai mat piyo, kali ho jaoge. Coffee mat piyo, aisa ho jayega." So is it true? Because this is something
Absolutely not.
not.
Absolutely not, because then everybody would just have white foods. Then the whole of South India, or the whole of India for that matter, wants to change their skin color. It has no role. What you eat, or eating darker foods is not going to change your skin color. There's absolutely no relation between this. No.
Great. I'm sure we all know this heart in heart that tea, chai, किसी से कोई फर्क नहीं पड़ेगा, but still, back of the mind, we are always looking out.
I think they just didn't want us to have tea as kids, and this was their way of saying it, probably.
Absolutely. Now, the next one is, only lasers and chemical peels can treat hyperpigmentation.
Not true. So you might come for laser sessions and you might do so many peels, but like we were just talking about, if you don't do maintenance, it's not going to help. And especially with chemical peels and lasers, what happens is that your skin obviously is getting more photosensitive in a little way, right? Because it's a treatment that we've done. Pigmentation is something that doesn't go away with, mild peels or mild lasers. So we have to do something slightly strong, which will actually go till the depth, which will go to the deeper layers of your skin. Which means it's going to have a little bit of an effect on the superficial layer also, even if you don't want to. So especially if you're going for treatments also, it's important to do the home care, and just doing treatments and not going home care is not going to get you anywhere. So I usually do not start patients that's why who are coming to the clinic for the first time, or whom I know will not use a sunscreen. There's no point of them, coming, investing money and time to get treatments done. They will not benefit from it.
Absolutely, truly true. The next one is, it's genetic and can't be cured.
So some sort of pigmentations maybe, but all the pigmentation I think that we spoke about right now, apart from melasma, so if your mom or your grandmom had it, you probably have a more tendency to it. But if you know that somebody in the family has it, maybe you can start being careful about it from a younger age, from your 20s itself. But a lot of it is not genetic, and that means that a lot of it is in your control.
Absolutely. In fact, I feel starting early is the key for any kind of a thing. Like, any routine, if started early, helps us. Similarly, skincare needs to be started early.
So now the whole concept of skincare is this word called rejuvenation. I don't know if you've heard about it, which means preventive rejuvenation. So even anti-aging, everything we're starting at a younger age, which basically goes by the theory of prevention is better than cure, right? So you don't let it go till there. You start taking measures to treat it or to prevent it so that it can be tackled in a simpler way.
So since you just mentioned about starting it early and rejuvenation, which is like preventive rejuvenation, I would want to ask, because most of these teenagers and younger kids, they don't know what they can do, and while their skin is undergoing the puberty phase, they have acne issues, they have a lot of other issues. So very quick tip, if you can help us for just this age bracket, what they can do for their skin in the early stages of life.
I think, Raki, what we should talk about with this age group is to stop doing extra things. Now, this is the generation which is doing a lot of things. So I see a 15-year-old asking me about anti-aging and vitamin C and everything. Why do you need all of this at 15? Okay. So I think the question has to be reframed. I see this generation because they're just very influenced by social media. They are on Instagram, YouTube, Facebook. They see a lot of home remedies. They see a lot of product recommendations also. And they don't understand that it's not for their age group. So for teenagers, I would say, please stop doing too many things. They are having like a 10-12 step skincare routine already. They're using 5-6 active ingredients at the same time. So what to do, I think, is secondary. I want to tell them to stop doing so many things. See, age is on your side at this age. I know skin can go through some changes because of puberty, because of hormonal issues. So basics, you have to keep it right at this age. So a good cleanser, cleanser, moisturizer, and sunscreen is all that is needed at this age. Appropriate for your skin type, I would say. So a lot of problems happen because they're using skincare that's not appropriate for their type. Sometimes because their skin is going through changes, they don't understand what their skin type is at the moment. So maybe you can take some expert advice about this, but don't just randomly follow, bloggers and influencers and start using products. We see them doing a lot of harm, and in the quest for glowing skin and skin lightening, whitening, we see a lot of educated girls, boys falling into the gimmicks of all these steroid creams where they don't really know that they're using topical steroids. So these are kids who are going to school and they are educated, but they are either given creams which do not have a label from friends, from salons, from pharmacies. The pharmacist itself will give it, but they don't know the ingredients. So know what you're using and don't start using topical steroids, especially on that skin which is still not even mature, right? So
absolutely. That's a very important thing, which I guess most of these kids do not know these days. And they are behind, they are almost running towards achieving something which is already there in them, but don't have to, run behind it, I guess.
Don't go by what you see on Instagram. Don't go by beauty standards of all the celebrities. That's not how half of their skin is. You haven't seen them without the filters. You haven't seen them without, the angles and the lights. So what you see is not what it is. And it's normal for skin to have some pores. It's normal. Even as a dermatologist, I have acne breakouts once in a while. So it's not like, okay, so you cannot get it at all in your life. You just have to tackle it correctly at that point. So don't, over-exaggerate the problem.
That's a very important thing, Dr. Nishita. I'm really thankful that you brought this point, because seriously, kids are just running behind. So great. I'll move on to the next one. Melasma or pigmentation caused by pregnancy is not treatable.
That's partly not true, I would say. It's treatable
Yeah.
once we get the hormones in control. So maybe during
Okay.
pregnancy, it might not be treatable because certain ingredients we cannot give you even topical usage when you're pregnant because of the
Yeah.
restrictions. We can only give you what's safe. But as soon as you
Yeah.
deliver and as soon as your hormones start coming back to the normal levels, then it is 100% treatable. Or if you're having
Okay.
pigmentation because of PCOS or because of menopause, then of course you will have to take measures to tackle the hormonal issue that's there and then
Yeah.
treat the pigmentation. Then it's treatable.
Understand. Understand. Then just two more left. Pigmentation treatments are expensive and ineffective.
That's again not true. And you can find good ingredients which are, formulated scientifically. They don't have to be expensive to work, firstly. Again, this is something that people believe, the skincare products have to be expensive. A lot of good dermatology range products, a lot of products are within the range that anybody can use for. Even ThriveCo has, I think, a lot of reasonably priced or reasonably ranged skincare, skin pigmentation ingredients line
Yes.
which will work. So you just have to look at the ingredients. It doesn't have to be expensive to work. That's not true. And even treatment options, there are treatments that range from just plain and simple chemical peels, which are not very expensive, to lasers and a lot of other high-end treatments. So there's a whole range of treatments that you can opt for. So it doesn't have to be expensive.
Absolutely. I'll definitely, for all the people who are listening to us, I'll share the product that we have for hyperpigmentation in our comments. So do check that out. The last one, Dr. Nishita, darker skin tones don't need to worry about pigment.
Don't need to worry about pigment. In
Pigment.
fact, darker skin tone, pigment
About
only.
around pigmentation. Yeah.
No, in fact, darker skin tone has a more tendency to pigment. If you notice,
Okay.
like a lighter skin tone, when they get tanned, they turn red. But a darker
Yes.
skin tone will turn black or darker.
Yes.
Not black, but maybe brownish in that
Yeah.
sense. Because that's
Yeah.
how the skin is, the cells in the skin react. So again, this is a myth. In fact, if you are in the darker or the duskier skin tones, you will tan more. But if you're in the lighter skin tones, you will probably have like a reddish hue to the tan.
Understand. Understand. Great. Thank you so much, ma'am. I'll very quickly just check onto the questions and then we can
Yeah,
take
yeah,
them.
surely.
How
Done.
can skin tags be removed near eye area?
Can you repeat that?
How can skin tags be removed near eye area?
So this is a very simple procedure. We usually do an electrocautery or a CO2 laser where we just, apply numbing cream and then take it off. It's a very simple procedure which doesn't take more than 5 minutes. And
Okay.
just the healing takes about a week, 10 days, and then it's completely gone. So getting rid of skin tags is a really easy
Yes.
treatment.
Yes. Ma'am, somebody has asked pigmentation on nose. What can be done?
Yes, so like we discussed briefly about this, I think. So one thing is if you're constantly touching the nose like that, or if you're wearing specs which have those nose pads, which is causing the pigmentation, or if you have a frequent cold cough and you're rubbing constantly with either a rough towel or a handkerchief or something, avoid that completely. First, stop the cause, like we said, then start using an SPF properly, and maybe you can use a spot treatment at night, which could, have either glycolic acid. Your AHAs, BHAs work really well because nose is usually an oily area for most people. So use an AHA or a BHA, not a combination, but either of them. If you have dry skin, then you moisturize first and use a spot treatment only on the pigment. And to see any difference with pigmentation, you will everything that we just discussed, it takes a minimum of 3 months for you to see a result. If you're not going to offer any in-clinic procedures. So if you're only going to, depend on topical agents, yes, they will work provided you use it consistently for at least 45 to 60 days to start seeing a result. And for you to see a visible result, it takes a minimum of 3 months. So consistency and patience is the key. You're not going to see a result otherwise.
Thank you for sharing this big point, ma'am, because most of the people, even we come across, they want instant results, which is just not possible. They need to have a lot of patience. So yeah, that's a great point. Ma'am, one person who had asked about side darkness that had happened on his face, he's asked if any cream you can suggest.
So like we said, again, just check your BMI, see if you're obese. Try and treat the obesity also. So you have to start losing weight if the pigmentation is because of that, because usually this can be acanthosis if the skin is very rough and velvety. For me to specifically suggest, a treatment, I'll probably have to look at you. But if it is because of acanthosis, again, you can look for ingredients like azelaic acid, glycolic acid, which will start softening the skin there and then remove the excess pigment that's there.
Yeah. Ma'am, somebody has asked how much tinted sunscreen should we use?
So tinted sunscreen is also the same amount that you need for a regular sunscreen. What you can do if you don't want the tint too much, then my recommendation for people who are working or going on holidays would be to first apply a non-tinted sunscreen, which could be like a moisturizing sunscreen, and then top it up with the tinted sunscreen. Then you can reduce the quantity of the tinted sunscreen if you're
Yeah.
using a two-layered sunscreen method.
Understand. Ma'am, last two questions we'll take. Darkness around lips, what can be done, and any cream?
Darkness around the lips, stop using very pigmented lipsticks. Usually lipsticks which are the transfer free ones, the liquid lipsticks are the ones which cause more pigment. Stop touching this area constantly. Maybe see if you've recently changed your toothpaste. Sometimes toothpaste irritation can also cause pigmentation there. And an ingredient that works really well around the mouth is something called as pimecrolimus. I like prescribing creams with pimecrolimus for around mouth pigmentation, but abroad this is only a prescription only medicine. In India you will probably get it, but would suggest meeting a dermatologist and speaking to them about this ingredient, which works quite well when used at night around the mouth.
Absolutely. Ma'am, last question. Any cream for bacteria scars?
Bacteria scars?
Yeah, I couldn't understand the question. If the user is listening, if you could specify a little more in the caption, that would be really great.
Bacteria scars, I don't know what that is.
Acne scars, lightening ointment on body.
Acne scars on the body, something that works really well. Maybe the back on chest, if you have scars, use a benzyl peroxide wash. At least alternate days you can start using that. You could look for, there are a lot of sprays with salicylic acid, clindamycin, nicotinamide, which is niacinamide. So you can use sprays on the body. They work really well. But then again, you will have to use it for a minimum of 3 months to see a difference.
Okay, great. Thank you, ma'am. We would like to conclude it with just 2 points now. Tips to prevent pigmentations, if there are any. I mean, if you have any tip, which I guess you had just mentioned that sunscreen is the first tip and people should use. But apart from this, if you would want to tell our audience about any other tip. So that was the first thing. And next I'll ask.
So I think we covered a lot of tips as we went through the life. Using a sunscreen properly, keeping your skincare routine simple, using skincare according to your age and according to your skin type, and then not using too many actives at the same time. A lot of times, one pigmentation that we did not talk about is contact dermatitis that happens because of overuse of products. So if you're using too many actives at the same time, that itself can induce pigmentation. You're probably trying to treat the pigmentation, but if you dry out the skin too much or irritating the skin too much, that itself can lead to pigmentation. So you don't have to have like a 12-step skincare routine that you're trying to do every day. You just need a few basic products which work right for your age group, for your geographical area, and for your skin type, and that will be more than enough.
Great, great. My next question was also around ingredient, which you have already answered. So I think that's about it. Thank you so much, Nishita ma'am. It was great to have you with us today and sharing all about hyperpigmentation.
Likewise, I had a wonderful chat with you. And if any of the others who are listening to the live or who will watch it later have any questions, they can feel free to DM me any questions about pigmentation. I will be happy to try and answer them in your DMs as well.
Absolutely. Thank you so much, ma'am. Good night. And good night to all of you watching us out there. Bye.
Thank you. Bye.